Hi there, Steve Thurman here with Medigap Tennessee, your source for Medicare Supplemental, Medicare Advantage, prescription drug, and dental plans in Tennessee. And here are 10 facts that you might not know about Medicare. Number 1. On July 30th, 1965, President Lyndon B. Johnson signed the Medicare and Medicaid bill of the Social Security Act in Independence, Missouri. Former President Truman was at the bill signing and was also the first person to receive a Medicare card. President Johnson remarked, "We marvel not simply at the passage of this bill, but that it took so many years to pass it." Number 2, about 10,000 people per day are turning 65 and aging into Medicare. The baby boomer generation is transitioning from the workplace into retirement and are taking advantage of the federal program after paying into Social Security for the last 40 plus years of their lives. If you were born between 1946 and 1964, you're likely part of this group. Number 3, contrary to what you might think, not every doctor accepts Medicare, but the vast majority of them do. It's estimated that over 95% of doctors in the United States accept original Medicare as primary coverage. Number 4, a doctor might accept Medicare, but not every doctor accepts Medicare assignment. Medicare assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare-approved amount as full payment for covered services. Doctors that don't accept Medicare assignment can charge extra fees in excess of up to 15% beyond what they get paid by Medicare. This is another reason why it's important to have the right Medicare supplemental plan to cover these excess Medicare charges your doctor or service provider may bill you for. Number 5, you can be penalized for not participating in Medicare when you initially qualify. In particular, those who don't enroll in Medicare at their first eligible time generally have to pay higher premiums once they do join. For Part B medical coverage, your monthly premiums will rise 10% for every 12 months that you could have been on Medicare but chose not to be. In addition, there's a similar late enrollment penalty for not taking Part D prescription drug coverage when you are initially eligible. Medicare calculates the Part D penalty by multiplying 1% of the national base beneficiary premium, currently $34.10 in 2016, times the number of full uncovered months you didn't have Part D or creditable coverage. The monthly premium is rounded to the nearest 10 cents and added to your monthly Part D premium. The national base beneficiary premium may increase each year as well, so your penalty amount could also increase annually. Number 6, Medigap plans and Medicare supplemental plans are the exact same thing. Like soda and pop, they're just different words for the same product. Medigap plans pick up the other 20% that original Medicare doesn't cover, and they are often referred to as secondary plans. There are currently 10 different Medigap plans available from about 50 different private insurance companies in the United States. While all 10 plans are standardized by the Center for Medicare and Medicaid Services, they all have different levels of coverage, different deductible amounts, and their pricing is not standardized. So companies can charge whatever they'd like for their Medigap plans. Prices can vary up to $150 per month between two companies for the exact same level of coverage. So this is why it's important to shop around and compare companies when choosing a Medigap plan. Number 7, you can change your Medicare supplemental plan at any time during the year and switch to a more competitively priced Medigap plan from a different company. However, there are only a few times when you can purchase a Medigap plan without having to answer health questions and pass a company's underwriting guidelines. One of those times is when you initially age into Medicare and start your Part B benefits. You'll have your 65th birthday month and 6 months after your birthday month to purchase a Medigap plan of your choice without having to answer any health questions, and you can't be turned down for pre-existing conditions. Outside of that window, there's only one other exception where you don't have to answer health questions, and that is called a guaranteed issue period. Guaranteed issue situations only apply to those losing creditable coverage, such as involuntarily losing employee benefits or involuntarily losing a Medicare Advantage plan. But if you're healthy and can pass underwriting guidelines and health questions, you can initially purchase or change your Medigap plan at any time during the year for any reason, as long as you have Medicare Parts A and B. Most people change plans because they get a rate increase or because they find a different provider for the exact same level of coverage for much cheaper. If you're healthy and think you're overpaying for your current Medicare supplemental plan, give us a call. We'll help you find a better price plan for the exact same or better coverage than you currently have. Number 8, Medicare Advantage plans are not supplemental plans. Medicare Advantage plans are not Medigap plans. Medicare Advantage plans are not secondary insurance plans. Medicare Advantage plans are managed care plans and referred to as Medicare Part C. They consist of HMO and PPO plans and are available with or without drug coverage. Medicare Advantage plans are administered by private insurance companies, and they replace original Medicare as your primary coverage. So if you have an Advantage plan, you do not have original Medicare paying your bills. You cannot have original Medicare and a Medicare Advantage plan, so you'll either have one or the other. When you have a Medicare Advantage plan, it is your primary coverage until you disenroll from the plan and go back to original Medicare as your primary coverage. You can only enroll and disenroll from Medicare Advantage plans during certain times of the year. October 15th through December 7th is the annual election period when you can enroll into or disenroll from your current Medicare Advantage plan. There are a few exceptions to this rule for individuals that get state subsidies like Medicaid, QMB, SLMB, or extra help from Social Security. Unless you get a low-income state subsidy, you will still have to pay your Medicare Part B premium with a Medicare Advantage plan. This is so Medicare can pay your Medicare Advantage plan company to administer your health care coverage. If you haven't figured this out already, it's called having a middleman, or to be politically correct, it's called having managed health care. Medicare pays the Medicare Advantage plan company, and the Medicare Advantage plan company pays your medical bills and also handles every aspect of your health care coverage. Just remember, Medicare Advantage plans are very different than Medicare Supplemental or Medigap plans. Take a look at our Medicare Advantage pros and cons video for a more in-depth view on these specific products. Number 9. If you have Medicare and some form of Medicaid, such as TennCare or the pink QMB card, you qualify for what's called a Special Needs plan. Special Needs plans are specifically for low-income individuals that have both Medicare from the federal government and some form of Medicaid from their state. These are zero-premium Medicare Advantage plans that include full drug coverage, as well as many other added benefits that original Medicare and Medicaid don't cover, such as comprehensive dental, yearly allowances for glasses or contacts, yearly allowances for hearing aids, monthly or quarterly allowances for over-the-counter products, transportation services, personal emergency services like Life Alert, and gym memberships like Silver Sneakers and Silver and Fit. These are zero premium plans, and all of these extra benefits don't cost anything if you have both Medicare and some form of Medicaid. You will continue to pay copays on your medication. However, your copays will be as low as possible. There are several special needs plans in the market, so if you have Medicare and some form of Medicaid from the state, like TennCare or the pink QMB card, give us a call and we'll tell you all of your options. There are some great plans that could help you out immensely. Number 10. Medigap Tennessee is your source for Medicare Supplemental, Medicare Advantage, prescription drug, and dental plans in Tennessee. If you'd like an in-depth and unbiased look at all of your Medicare options, or just want to ask us some questions about these confusing products, just pick up the phone and give us a call for a free, no-obligation consultation. We'll spend as much time with you as you need so you can be sure you're making the right decisions the first time. Remember, Medicare doesn't cover everything, so call us at 1-800-431-5431 and let us help you zap the gap.